So where we left off on the reproductive system, we were about to talk about the menstrual cycle. So there's things that happen basically pre-ovulation and post-ovulation. We'll start with pre-ovulation. So there's a phase that we call follicular phase in the ovary, and you'll have basically several ovarian follicles that start developing. And only one follicle is going to actually continue to develop and will secrete growing amounts of estrogen. Remember, that's one of the hormones. All right, and it causes more gonadotropin releasing hormone, GnRH, to get released from the hypothalamus. Remember the hypothalamus when we study the endocrine system, right? Then we get a surge of luteinizing hormone, LH, and that's going to trigger ovulation. All right, so then you'll have menstruation, and then you'll get the proliferative phase that starts occurring in the uterus. All right, so then post-ovulation, the empty follicle becomes something we call the corpus luteum, and we enter what we call the luteal phase. And that corpus luteum then will secrete another hormone, progesterone, as well as some estrogen. And as the levels of progesterone start increasing, the levels of the luteinizing hormone, LH, start decreasing. And then it actually causes the corpus luteum to start to degenerate or break down. Then we enter the secretory phase. It starts in the uterus, and there, what we call the endometrium is going to start thickening, right? It's that lining. And then the uterine glands will mature and produce a thick secretion. And if you get fertilization of the egg cell, right, the oocyte, and then you get implantation in the uterus, human chorionic gonadotropin, or HCG, will be released by the placenta that develops. All right, so there's a lot of words. So what does that look like? So, and you may look at this picture and say, well, there's a lot of stuff there. Well, there is, but let's kind of look at it by days, right? So it's here. You can see what's going on at different days across all these different areas. So you have the hormone levels, the ovarian events, the uterine cycle, and your endometrium levels, right? So during menstruation, the first few days of the cycle, the uterine cycle, all right, so you actually have a high level or thick endometrium, but the bleeding is going to cause the endometrium to get smaller. All right, and during that time you have medium levels of estrogen, low levels of progesterone, and during that time the follicle is developing. All right, and during that time you kind of have moderate levels of FSH and LH, follicle stimulating hormone and luteinizing hormone. Okay, as you move into the proliferative phase, when you're about day 4 to day 13, you start seeing endometrium start getting thicker again, right? More blood vessels, or the blood vessels will get thicker. All right, you start getting an increase in estrogen here. Follicles maturing, okay? And your LH levels get higher than your FSH levels, okay? Now you get to ovulation. Around day 12, day 13, you get a spike in your LH and FSH levels, right? And you get a decrease. You have this spike in estrogen. Now the estrogen is going down, it's decreasing, right? And you start to get a little bit of increase in progesterone, and you can have added thickening of your endometrium. As we enter the secretory phase, it's where you have really thick endometrium. Your progesterone levels trigger, and they increase. Your estrogen levels increase slightly, but not as much as your progesterone. And then you start getting that early corpus luteum, right? Your FSH and LH levels start to decrease from where they were at ovulation. As you get toward the end of the secretory phase, all right, you start getting less thickening into that luteal phase, and your estrogen and progesterone levels decrease, your corpus luteum regresses, and your FSH goes slightly higher than your LH. Okay. All right. So before we move on to menopause, let's take a moment and talk with your battle buddies about events that occur during the uterine cycle. You can do this with your partner, or you can do this at home as well. Okay, so the next portion of female reproductive physiology that we're going to cover is menopause. All right, and that's when the menstrual cycle stops. And so in this portion of life, the ovaries don't respond to the gonadotropin hormones anymore. Okay, and the levels of estrogen and progesterone decrease. All right, so you probably have heard of people that got to this stage of life and took hormone replacement therapy, estrogen and progesterone, so that's why. The uterine cycle is going to be more irregular at that point, right, because of the lack of response to the hormones. And these changes in the hormones are going to cause some physical symptoms. You've probably heard of the hot flashes, dizziness, headaches, insomnia, and depression, right? So these are why people have taken hormone replacement therapy to help deal with a lot of these symptoms. All right, so in terms of another portion of the female reproductive systems dealing with basically breast as well as the process of lactation. And so budding in the breast happens during puberty, right, during the teenage years. And so it's followed by development of different lobes there. And you also, there's also increase in adipose tissue. So during pregnancy, they'll actually enlarge in the ducts. And you also have alveoli in the breast tissue, and those basically the ducts and the alveoli increase in size as well as number. You're typically not getting any milk produced during pregnancy. All right, so and the reason for that is that in order for lactation to start, you have to have the hormone prolactin. And after birth, the prolactin gets secreted from your anterior pituitary. Remember the anterior pituitary from the endocrine system, right? So that's not being secreted until after birth, right? So that's why you wouldn't have lactation before then. Okay, and what the material called colostrum is actually produced in those first few days after birth, right? So it's a different kind of consistency. And for continued production of the milk, there has to be that suckling by the baby. All right, so here you get a anterior medial view. All right, so here you can see the mammary ducts, and here's a mammary lobule, right? On the superficial surface, obviously you can see the nipple and areola around it. Let's see, on the sagittal view, again, you have another view of the nipple where you can see the mammary ducts that secrete milk into the nipple. You can see this adipose tissue surrounding it. All right, and this is a lobule right here. And so these are the lobules, these are the alveoli, right? Or, sorry, excuse me, the lobules have the alveoli in them. These little passageways are the ducts. Right? So the ducts are the little passageways. These look like kind of like the alveoli in the lungs if you were to go to a higher level of magnification, right? And because it's a sagittal view, you can see some different muscles. So here you can see these muscles in between these bones. Those bones, what are those bones? Do you already know? Ribs, the rib cage. So we call these intercostal muscles. So another word for rib is costal. So those are intercostal muscles here. All right. This kind of muscle, thin muscle in the middle is your pectoralis minor, and the more superficial, larger muscle is your pectoralis major. Okay. So those are some of the structures that you need to know. All right. So we talked about how the reproductive system works normally. All right. So before we get into how a person can control the reproductive system as well as sexually transmitted diseases, we'll take a break to talk about lactation and the rest of the anatomy. So you can talk about that with your battle buddy, and you can do this at home as well. Okay, so now that we've covered how the reproductive system works and reproductive cycle in the female, let's go ahead and talk about ways to control reproductive system. So contraception is a way to prevent pregnancy. Typically, a person's doing that in consultation with a healthcare provider. There's different methods to do that. There's natural methods. There are methods that do not involve prescriptions. There's some hormonal prescriptions that can be taken. You can have a prescription barrier that prevents fertilization, as well as surgical sterilization. And there's research that's ongoing to find new methods of contraception. All right, so natural methods include things like abstinence, natural family planning, in terms of looking at days of ovulation, withdrawal method, also douching is considered natural methods. Non-prescription would be things like male and female condoms, spermicides, jellies, foams, creams and tablets, as well as sponges. On the prescription hormonal side, basically they are combinations of hormones as well as the vaginal ring. They have progesterone injections like Depo-Provera. You have progesterone only implantable rods like Implanon, and more emergency methods of contraception. On the prescription barrier methods, you have things like the diaphragm, which is a barrier that's actually inserted into the body. Cervical cap, that's a cap over that's held over the cervix. And a cervical shield. You also have intrauterine devices like the copper T and the progesterone releasing type. And on the sterilization for males, there's the vasectomy, where the vas deferens is cut and tied so that basically sperm can't get out of the body. And for females, there's tubal ligation or transabdominal surgery, where the oviducts are cut and tied. And then there's sterilization implants or Escher systems, where a small metallic implant is placed into the uterine tubes and it's inserted basically through a catheter. All right, and on the prescription hormonal methods, you also have a combined hormone pill that's taken daily. There's a progestin only mini pill. There's a combined hormone 91, which is a daily regimen. And the user is only going to have 3 to 4 menstrual periods a year. That happens as opposed to 1 a month. All right, and then there's a combined hormone patch. That patch is going to be applied to the skin and then left in place for a week. All right, and then each week they'll put on a new patch. All right, so it's just kind of a picture of different methods of contraception. All right, so some of these are pills or prescription. Some of these are injections. Some of these are barriers. Right. All right, so a little more on the emergency contraception. So there's the morning after pill that can prevent pregnancy after unprotected intercourse, and then you have medication that's going to upset your normal uterine cycle, and it can prevent the embryo from implanting in the uterus. And its effectiveness is estimated to be around 80%. It has side effects like vomiting, abdominal pain, nausea, headache, and fatigue. There's also mifepristone, which is also known as RU-486, and it can cause it allows the embryo to implant, but then it can make basically the embryo not survivable. So, and it's considered to be 95% effective at terminating the early pregnancy. Still, obviously, the most reliable method of birth control is abstinence. And in addition to preventing fertilization, it's also going to prevent STDs, because if there isn't any relation, then there's not going to be any transmission of diseases. All right. Now, we also have, we've talked about fertility kind of normally, but there are also cases where people may not be able to have fertilization. So an infertility as a definition just means there's failure to achieve pregnancy after basically a year of regular and unprotected intercourse. All right, 15% of all couples are infertile, right? So that's less than 1 in 10, right? So it's not like it's just only 1%. It's 15%. In terms of the reason, 40% of that's attributed to the male, and 40% is attributed to the female. 20% is attributed to both of them together. Okay, so I think there's societally, if women are unable to conceive, sometimes it's considered to be it's the woman who's the reason for that, and 40% of the time it's not, right? So, what are the causes of infertility? So, for males, it can be low sperm count, and so basically not having enough sperm, or B, a large proportion of that sperm are abnormal, right? So maybe they're not able to move, right? They're not able to swim effectively to get to the egg. Could be from different chemicals the male is exposed to. Could be a person exposed to lots of herbicides or pesticides. Could be smoking, alcohol, or drug abuse could cause this. If the testicles are overheated, it could cause this. So part of the reason why physiologically the testicles are outside they're still essentially part of the body, but they're not inside the abdomen, right? So part of that's because internally the abdomen is much warmer, right? And so the testicles don't need to be at that body temperature, and that's why they're not there. So for females, body weight is actually the most significant contributor to infertility. And the uterine tubes are blocked due to pelvic inflammatory disease as well as endometriosis. Okay. So if the uterine tubes are blocked, then the egg is not going to be able to implant in the uterus. But there are things that people can do to help with this. So we call those assisted reproductive technologies. One is artificial insemination, right, where the female is inseminated with sperm. In vitro fertilization, so maybe if fertilization isn't able to happen naturally, it can basically happen in a test tube and then that be implanted into the female. Intracytoplasmic sperm injection. So essentially this is another way of getting the sperm to where it needs to go. All right. So now that we've covered infertility, let's talk about sexually transmitted diseases. So sexually transmitted diseases can be caused by a variety of organisms, not just one or two. In humans, do not develop effective immunity to any STDs. All right, so you're not immune to STDs. And any person that gets exposed to an STD needs to seek medical treatment immediately. All right, so latex or polyurethane condoms can be used to prevent spread of these STDs. And in the case of STDs that are caused by viruses, treating them does not really eliminate them from the body, right? You're just essentially treating the symptoms, which you're not necessarily getting rid of the virus. So, and only STDs that are caused by bacteria are curable with antibiotics. Why? Because antibiotics are designed to kill bacteria. Okay, so if a person has a viral STD, an antibiotic won't help them. All right, so some different examples of STDs. You have genital warts, and these are caused by the human papillomavirus, or HPV. All right, and there's a new vaccine that's been released for HPV, and that's for the virus that most commonly is the cause of those genital warts. And they can be associated with cancer in the cervix. So there's the genital herpes vaccine, and it's caused by the herpes simplex virus. And there's two types of herpes. So there's type 1, and it will typically cause cold sores and fever blisters, right? And type 2 causes genital herpes, right? So, sometimes if you know people that they get the cold sores and things like that, fever blisters, they may have type 1, but it doesn't mean that they have type 2, right? They're two different types. So, if somebody says, well, they have, or that person has herpes, you don't really know whether or not they have type 1 or type 2. All right, so hepatitis. All right, so HEPA has to do with the liver, like hepatic. And so it infects the liver and it can lead to failure of that liver, can lead to cancer of the liver, and it can cause death. So there's actually 6 viruses that we know of that can cause hepatitis. And so we have hepatitis A, which is transmitted sexually. Hepatitis B could be spread sexually, but it also can be spread through bloodborne transmission, right? So sometimes people can get hepatitis B if they work in maybe kitchens or things like that, and people aren't using sanitary practices, and someone has cuts and not taking care of that properly. Hepatitis D and G are sexually transmitted as well. There is a combined vaccine that's available from hepatitis A and B. All right, chlamydia. So it is caused by a bacteria, and that is Chlamydia trachomatis. And it's typically going to be either asymptomatic, meaning you don't see any symptoms, or very mild. But it can cause ulcers of the cervix, which actually can increase the risk of getting HIV, so it can cause you to get other illnesses. Pelvic inflammatory disease, or PID, can also result if you don't get proper treatment for the chlamydia. Gonorrhea is caused by a bacterium, and that one is Neisseria gonorrhoeae. All right, so infection can actually lead to that pelvic inflammatory disease in males as well as females. And gonorrhea Hepatitis is infection of the anus. Oops. So oral and genital contact can lead to infection of the mouth, the throat, and the tonsils. Right? So basically anything that's exposed to that bacterium, it can, basically take root there. All right, so and unfortunately, this bacterium is becoming more and more resistant to antibiotics, right? And so if they're resistant, that means that you're not really able to treat it at that point. All right, syphilis is caused by the bacterium Treponema pallidum, and penicillin is an effective antibiotic for syphilis. There's 3 stages to it. There's a primary, a secondary, and a tertiary stage. There's also congenital syphilis, which is caused by some sort of bacteria that is syphilitic, and it crosses the placenta. So if the mother has it and it gets into the bloodstream, crosses through the placenta, the baby could get it. Okay, so in that case, it's congenital. All right. So historically, historical, I don't know how many of you are familiar with things like the Tuskegee experiment. This was kind of a study that was done many years ago just to find out kind of how, learning about the different stages, basically. And unfortunately, there were men who, were not given penicillin so that, that we would know the different stages. And obviously that kind of research you can't or shouldn't do now. And most of those were African-American soldiers, but this is kind of a significant study of syphilis. All right. All right, so I think let's take a pause, and so you can talk to your partner about some of the STDs that we've studied. You can do this at home as well. All right, so as we do with every organ system, we kind of conclude with the discussion of what the effects of aging are, as well as homeostasis. So for aging, as a person gets older, typically the sex hormone levels are going to decrease, and menopause is typically going to occur around the ages of 45 and 55, somewhere in that range. For men, typically testosterone production is going to diminish steadily after the person gets to be about 50 years old, and that can actually lead to enlargement of the prostate, or at least one of the causes. Typically, production of sperm is going to decrease as a person gets older, but men can actually remain fertile well into their old age. And so, you've probably seen some examples of really older men who end up having children at an older age. All right. And as males get older, their basically chances or likelihood of erectile dysfunction can increase. And as far as homeostasis goes, or equilibrium or balance, the estrogen typically is going to promote fat deposition, right? And so basically making the fat attached to the body. So more estrogen, it might be harder to get rid of the fat. And as we know, fat is a source of energy, but it also provides insulation. And estrogen can also cause the liver to make proteins, right? So you need proteins. And it can also lead to making of bone matrix proteins, so proteins that contribute to your bone matrix. And remember, we learned in the skeletal system, there's sort of this balance between building up a bone and then breaking down a bone, right? So the androgen hormones, more generally, will stimulate production of structural proteins in your skeletal muscles as well as your bone. So like your testosterone, things like that can help with muscle and bone production. And androgens can also affect how your different enzymes work in your kidneys and your liver. Okay? And we know the kidneys involved with filtration of the blood, water and salt levels in your body. All right, so that's one system affecting another system. You know, your kidneys also, or your liver's rather, is filtering your blood, getting rid of old damaged cells, you know, getting rid of toxins, things like that out of your body. All right, so again, you know, one system affecting another, right? So that is a overview of the female and male reproductive systems. So, all right.